I would like to share some highlights in follicular lymphoma from the Lugano meeting. So initially at the translational level, Dr. Roland presented new data using single cell analysis to understand the follicular lymphoma heterogeneity. And their group identified 10 distinct follicular lymphoma subtypes, moving beyond the traditional idea of follicular lymphoma as a continuum between germinal center and memory B cells. Importantly, these subtypes appear to have different clinical behaviors, and the group is now working to also combine microenvironment profiles. And I think one of the most interesting findings was that treatment responses varied by subtypes. So one group of patients had poor outcomes when they treated with R chemotherapy, but those that treated with R square, rituximab lenalidomide, did significantly better. And that suggests that molecular profiling could guide maybe treatment selection in follicular lymphoma. And so I think this is very important. And to go from there, so in terms of treatment advances, Dr. Mancusi from MSK presented data on a very low dose radiation therapy. They compared patients that treated with 4th grade to patients that were treated with the traditional 24 grade. And those that treated with 4th grade had similar progression rates. And that's promising to know. And they are now, based on this finding, conduct a prospective trial to compare patients 4th grade versus 24 grade with limited stage follicular lymphoma. And then there was a study presented comparing ibrutinib rituximab versus rituximab alone for previously untreated patients. They were not eligible for chemotherapy. And they showed that for patients that were treated with rituximab ibrutinib, there is higher progression-free survival, but there were a lot of criticism around these eligibility criteria who the patients that are not eligible for chemotherapy. And also the control arm was rituximab alone, which is maybe not appropriate for treatment with high tumor burden follicular lymphoma. In another frontline study, Dr. Falke presented data on mosunetuzumab, a specific antibody in newly diagnosed follicular lymphoma. A fixed duration regimen of mosunetuzumab resulted in 95% overall response rate with 82% complete response rate, which looks very promising. And outcomes are definitely comparable to the standard immunochemotherapy that we give standard of care now. And these results were consistent across all the subgroups, including high-risk patients, and there were no new safety signals observed. To mention, the follow-up is still very short. It's around 17 months. And so these findings are interesting, but should follow longer follow-up for sure. And in the relapse refractory setting, Dr. Sen presented the phase 3 trial, IMINE trial, which compared tafa-len and rituximab to R square. And also this triplet significantly reduces the risk of progression, relapse or death, and the benefit was also consistent across different patient subgroups. And there was even a trend toward improved overall survival. So this combination was now approved by FDA because of this study, and that's great to know. And lastly and finally, Dr. Casuto presented data from the LEO cohort and the transformation of follicular lymphoma. And we all know that in follicular lymphoma, transformation is one of the most important events, and this changed patient trajectory. And for patients they looked at patients with sequential transformation versus composite transformation, and they found significant differences for patients who had sequential transformation, especially those that were previously treated for the follicular lymphoma and were exposed to anthracycline. They had the worst prognosis, and those who transferred without prior treatment did better. But the composite lymphoma that were diagnosed in the same time with transformation they were the more favorable. I think this suggests that transformation in follicular lymphoma also represent different clinical entities, and so there are different follicular lymphoma transformation with different biological behaviors. And the treatment history is very important as it may shape the transformation risk and outcomes. That's all the Lugano. I think in follicular lymphoma, we learned a lot about follicular lymphoma biology, and how this might guide our more smart, more personalized treatment strategies in the future.